From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
Good morning. Welcome to Medical Forum. I'm your host, Jeff Reed. I'm here with Dr. Chris Mahr. Chris, we come to Sumter. We come to Florence, Bishopville. We're right here in the surrounding communities every Saturday here on 105.9 Community Broadcasters. We talk about everything happening in medical. And, I want to thank our sponsors real quick. I want to give Palmetto Toomey a quick shout out. I want to give Reliable Medical Equipment, At Your Service Home Care, Tri-County, Colonial Family Practice, all the many entities of Colonial Family Practice, of course. Last week, for those of you who joined us, we talked about stroke. It was May. May seems to be a lot of ailment month, but it was stroke month.
ailment
Because we're going to talk today. We're going to talk about arthritis and osteoporosis and rheumatoid arthritis and all the difference. And it's also, that is the disease of the month of May nationally as well, Chris.
Osteoarthritis month.
Yeah.
Is that what you're telling me?
So actually, lupus
and stroke, lupus, and osteoarthritis month.
And the Indy 500. Which is in May, Memorial Day, Indy 500. See, I'm from Indiana, so I'm going to throw that in there. Yeah. But last week, great show, very knowledgeable, got a lot of comments on it, and I think the biggest thing that everyone took home, Chris, with stroke, there's a lot of signs. They come on very sudden, and that's what I think you really emphasized. In
remembering the fast mnemonic and any signs or symptoms of stroke, that's a trip to the emergency room right away.
And we are the stroke. This is the stroke
belt. Didn't you say that?
Yeah, and we are the buckle.
I heard we're the buckle.
How about
that? So
that's crazy.
Lifestyle, right?
Yeah.
Smoking.
Yes. Oh gosh. Is there anything smoking doesn't affect while we're just on that subject? Let's just get it out of the way. It's been our elephant in the room.
Anything it doesn't affect. The pressure in your tires.
Your jump shot. Well, no, it probably takes a jump shot since we're in basketball season. All right. Let's talk about it. So we are arthritis, you tell me, which one do you want to hit on
first? We're
talking
about this week, osteoarthritis. I thought we'd take a few minutes to talk about osteoporosis. That was something that we had talked about.
Yeah.
We can talk about osteoporosis pretty quickly.
Let's talk about osteoporosis.
Pretty important gig, right? So osteoporosis is a thinning of the bones, right? It's an age process, often affects women. So, osteoporosis can occur as one ages. Again, it is caused to become weak and brittle, the bones, okay? So brittle that even a mild traumatic event like a fall can cause a fracture. Just
why women more than men?
Hormones, and we're going to get into that in a bit, but hormones play a big role in why the bones thin as we age. A lot of risk factors too, but guess what? Smoking's one.
Believe
it or not, it's bad for your bones too. So we'll talk about that in a minute. But again, bone is just a living tissue, okay? Constantly being broken down and replaced. So we have cells in our body that break down the bone and then replace the bone and rebuild it. So for instance, if you break your arm, you have cells in your body that will remodel the bone, fix it, and repair it. Okay, so osteoporosis occurs when the creation of new bone can't keep up with the removal of the old bone. So you have certain cells in your body that are removing the bone, increasing the calcium levels in your body, reshaping the bone. Oftentimes this is a structural entity to strengthen the bone. But when the breakdown exceeds the rebuilding or remodeling, that's when we have osteoporosis. And we'll talk about it a little bit later as well, but there's drugs and they hone in on trying to stop that breakdown. Osteoporosis affects men and women of all races, but white and Asian women, especially older women who are postmenopause, so after they've stopped menstruating, are at the highest risk. So unlike some of the other diseases locally, diabetes, renal disease, coronary disease, who seem to affect African Americans a little bit more, osteoporosis affects white and Asian women the most.
Is that a reason for that?
I don't know the answer.
Because calcium always is one that people always throw out. Not enough calcium.
Yeah,
your bones are going to be brittle.
And we're going to talk about calcium and calcium supplementation in a bit, but that's important and how to treat it. Medications, healthy diet, and weight-bearing exercises help prevent bone loss and strengthen the already weak bones. A lot of patients will come into my office and they'll say, this hurts, that hurts, I think I have osteoporosis. Generally speaking, osteoporosis, which is simply the thinning of the bones, is an asymptomatic syndrome, meaning most patients do not have symptoms. At least if they have symptoms, they are typically not related to the osteoporosis.
You see it in the upper body, lower body, equal? Could it be in my arms, my legs? It seems like I always see it, at least reliable, in the legs.
Right.
So I've got osteoporosis and knee braces and something to take away that pain.
So the reason we're seeing it in the low back and in the hip those are the two areas that we test to determine the strength of the bones. So we're doing a test called a DEXA scan, which is similar to an X-ray. It looks at the lumbar spine and the low back and the hip itself, and that's where we determine the disease. That's how the disease is diagnosed. So when a patient says that they have osteoporosis in their low back and hip, well, that's typically because those are the areas that were tested in the DEXA scan. However, they probably have osteoporosis in other areas of their body. So again, there's typically no symptoms, especially in the early stages of bone loss. But once the bones have been broken down and weakened by osteoporosis, signs and symptoms can be caused by the sequelae of the osteoporosis. So for instance, if a patient has brittle bones in their low back, they can suffer a fracture in the vertebrae. This is often called a compression fracture, causing collapse of the vertebrae. It's not a typical fracture we think of as a fracture of the arm where you have a clear break across the bone, but it's more of a smash fracture. So it's compressing the vertebrae. The vertebrae actually lose height. And these are very painful fractures. So it's not the osteoporosis that's causing the pain in the back. If they have pain in the back, secondary to osteoporosis, it would be more likely due to a compression fracture. Other patients will note loss of height over time. So we say we shrink as we age. We absolutely do, especially if compression fractures are caused. There is a stooped posture which often occurs. Now, the stooped posture can be a result of osteoporosis, and that posture in and of itself can cause pain in the muscles and joints around the back. And then, of course, bone fractures are
more susceptible to these fractures, obviously. And when we talk about narrowing of the bone, is this, if I'm taking like a bone, does it literally shave off the bone, Chris? I mean, if we took a tibia, which is a fairly thick bone in your lower body, if I had osteoporosis in the tibia, does it get smaller? Is it thin, or does it get just more feeble?
Think of it as an issue with density of bone, not an issue with size. So the size of the bone is not going to decrease, but the density of the bone is going to decrease.
He's Dr. Chris Mahr, and we are talking about osteoporosis, and we are Medical Forum, coming with you today on Saturday morning, and of course we re-air on Sundays from 2 to 3, and we'll be back right after this message.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home, and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment, locally owned and operated since 1999, provides a full range of medical equipment and services. Our accredited facility is fully staffed with the certified personnel for all your diabetic shoe, custom orthotic bracing, and prosthetic needs. Conveniently located at 246 Broad Street, right across from Firestone and just down from Colonial Family Practice. We accept Medicare, Medicaid, TRICARE, and most private insurance. Stop by today or give a call at 934-9212. That's 934-9212 in Sumter or 435-9927. 435-9927 at our Manning location at 37 West Rigby Street. See why Reliable Medical Equipment has been voted best facility for prosthetic and orthotic for 7 years straight. Reliable Medical Equipment.
Looking for your doctor? We're pleased to announce the Toomey Medical Professionals practices became part of the Palmetto Health USC Medical Group. With 500 physicians and providers, we are working together to bring you and your family the broadest range of healthcare services in our practices and across the system, including at Palmetto Health Toomey. Also, you can get the very best care right here. To find your doctor today, visit phuscmg.org. That's phuscmg.org.
This is Medical Forum, presented by At Your Service Home Care.
Okay, and we're back on Medical Forum. Got Dr. Chris Mahr in the house this morning, and we're talking about osteoporosis. Chris, when we left the last segment, we were talking about with bones and such. What are some of the causes of osteoporosis?
So again, going back to what I said from in the beginning, that osteoporosis is a disease of bone breakdown. So the bone is breaking down quicker than we're building it back up. In our early 20s is about when we peak with our bone density or bone mass. And so as we go on from our 20s, the bone mass is lost faster than it's created. So how likely you are to develop osteoporosis depends a lot on you. It depends on your risk factors. But it also depends on what you take into your older age. It's kind of like your savings account, your retirement account, right? What you've got to spend in retirement is dependent on what you save up going into retirement. So bone density is very similar. So what you take into your older years is what you've got. And that really has a lot of impact on how strong your bones are going to be later in life. So for instance, bone in the bank, is what we're talking about. Someone who's very active, right, in their early years, weight-bearing exercises are very important. Lifting weights, resistance training, things of that nature. So you're going to build very strong bones, right? Guess what? One thing would be to that would cause bone destruction early in years. We've talked about 100 times. Smoking, right? There's a bunch of other things too, but so smokers
working out. I'm not going to be breaking my bones. I'm enhancing. This is good for my bones.
You're depositing calcium on those bones, especially when it's load-bearing exercises. So walking is great, swimming is great, and we always talk about those exercises that are low impact. Those are great for treating symptoms such as osteoarthritis and reducing pain. But those lower impact exercises like swimming don't build bone like load-bearing exercises, weight training, and things of that nature. Okay. So again, when we talk about the causes of osteoporosis, we have to really think about our bones peaking in our 20s. What do we have in the bank? What are we taking into retirement as far as our bone strength? Risk factors. I mean, we can't talk about all this stuff without talking about risk factors. We always talk about two types of risk factors, the ones that we can change and the ones we can't change. So the modifiable and non-modifiable. So the things that you can't change, right? You can't change your sex. Well,
because women are more prevalent.
Well, right. So so women are more likely to develop osteoporosis than men. Age, the older you get, the greater risk of osteoporosis. Race, we talked about the two races that have the highest incidence, white and Asian women. Of course, family history. I always tell my patients apples don't fall far from trees. So how we're going to do later in life is vastly dependent on how well our family's done, our parents have done, and things of that nature. So family history is always important. Body frame and size, a little bit interesting. Men and women who have small body frames tend to have a higher risk because they may have less bone mass to draw from as they age. So it's, again, what are you taking into it? Hormone levels. This might answer some of the questions about why certain people are more inclined to osteoporosis. But it's more common in people who have too much or too little of certain hormones in their bodies. Give you a couple examples. Thyroid, okay? Patients who have hypothyroid disease have an increased risk of osteoporosis later in life. So treating an underactive thyroid with medication is important. Sex hormones. Lowered level of sex hormones tend to weaken the bones, okay? So reduction of estrogen levels at menopause is one of the strongest risk factors for developing osteoporosis. And then women also may experience a drop in estrogen during certain cancer treatments. Some cancer treatments are estrogen dependent, so we give medications to block the effects of the estrogen, and so that can affect it as well. Men experience gradual reduction in testosterone levels as they age. That's just kind of the normal aging process. And as some of the treatments for prostate cancer, for instance, can lower the testosterone levels. So that can increase the risk of osteoporosis.
Wow.
Getting right into the dietary stuff, okay? So let's talk about the calcium. Calcium is important. Calcium is the building blocks for our bones. That's what makes our bones strong, right? So a lifelong lack of calcium plays a major role in the development of osteoporosis. Low calcium intake contributes to diminished bone density and early bone loss.
So this can start at a very early age.
It can, but let's talk about calcium though. The body regulates calcium very tightly, and generally speaking, most people's calcium levels are normal, okay? Even if they're not taking in a lot of calcium. So if you're not taking in a lot of calcium though, your body, if it needs calcium, it gets it from your bones.
And
so,
let's do one thing real quick. Let's let people know what has calcium in it that we eat. Obviously, we know of milk, cheese,
dairy products,
dairy
things
products.
of that nation, or just supplemental
Can
calcium.
supplements work?
Absolutely.
Okay.
Absolutely.
A lot of people think they just urinate the supplements out. It doesn't work, but it is an effective calcium.
So calcium supplementation. There's been a lot of study in the last couple of years about calcium supplementation, about vitamin D. Vitamin D is allows the calcium to be used properly. So we need to normalize vitamin D levels if they're low. But calcium supplementation is a little bit of a sticky wicket right now. There's some controversy about women taking calcium and not taking calcium. Generally speaking, I think for a postmenopausal woman, it's reasonable.
Can you take too much?
Yeah, sure.
Absolutely. And what are those effects?
Hypercalcemia, when you take too much, can cause problems in the stomach, can cause problems with nervous tissue, and some other things. So yes, you can certainly take too much, but taking a tablet of over-the-counter calcium citrate every day is certainly not unreasonable. You can get calcium from predominantly two different sources over the counter in a tablet form. One is calcium carbonate, which is Tums, Tums that you can just chew those up. Now, calcium carbonate is not absorbed well in the stomach, and so we only take in about 20-30% of it. Calcium citrate, which is the name brand like Citracal, this is a much more usable form of calcium, and you absorb a significantly greater amount.
Does a multivitamin have enough calcium?
They do, but probably not unless it's a multivitamin for women. So just a little supplemental calcium. But again, eating disorders, anorexia, bulimia, things like that can increase your risk. Gastric surgery, a lot of us don't think about this, but a lot of people are having bypass surgery for weight loss. This can significantly affect the amount of calcium that's absorbed through the lining of the stomach.
Really?
Yeah, and increase your risk for that. One of the big ones are steroids. Now, we're not talking about the Arnold Schwarzenegger steroids. We're talking about the prednisone, right? Yeah. So prednisone is used pretty commonly in modern medicine for a multitude of things: asthma, osteoarthritis, lots of different things, rheumatoid arthritis. Prednisone is a wonderful drug, makes everybody feel better, but it has to be used cautiously.
Boy, these got some side effects.
And patients who are on long-term prednisone have a super high risk for osteoporosis.
Chris, hold that thought, because I do want to talk about prednisone more when we come back, because a lot of people have that in their dietary with being prescribed for that. And we'll be right back. We're back on Medical Forum. I want to thank Reliable Medical Equipment, 934-9212 on 246 Broad Street. Always a great sponsor. And we'll be back, and we'll continue to talk about osteoporosis and prednisone. Thank you.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
Looking for your doctor? We're pleased to announce the Toomey Medical Professionals practices became part of the Palmetto Health USC Medical Group. With 500 physicians and providers, we are working together to bring you and your family the broadest range of healthcare services in our practices and across the system, including at Palmetto Health Toomey, all so you can get the very best care right here. To find your doctor today, visit phuscmg.org. That's phuscmg.org.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation. 607-9677.
Reliable medical equipment, locally owned and operated since 1999, provides a full range of medical equipment and services. Our accredited facility is fully staffed with the certified personnel for all your diabetic shoe, custom orthotic bracing, and prosthetic needs. Conveniently located at 246 Broad Street, right across from Firestone and just down from Colonial Family Practice. We accept Medicare, Medicaid, TRICARE, and most private insurance. Stop by today or give a call at 934-9212. That's 934-9212 in Sumter or 435-9927, 435-9927 at our Manning location at 37 West Rigby Street. See why Reliable Medical Equipment has been voted best facility for prosthetic and orthotic for 7 years straight. Reliable Medical Equipment.
This is Medical Forum, presented by At Your Service Home Care.
And we're back on Medical Forum. I want to thank Dr. Chris Mahr for taking his time out to come in on a Saturday morning to educate us on osteoporosis. Chris, when we left, prednisone was brought up. Probably the most well-known drug when you deal with a therapy for so many things. Steroids.
Yeah, autoimmune diseases. There's
Yeah.
a lot of patients who have to take prednisone every day to maintain the control of their chronic diseases. So those patients are at very high risk of osteoporosis, and I recommend screening DEXA scans much earlier than typical. So typically we're screening somebody when they're postmenopausal, most commonly.
Let me ask you that.
Postmenopausal female.
Every show that we've had, we've talked about diagnosing early. And that's one of the things I think you guys do great at Colonial Family Practice, is that you have so much technology and you are screening people early. And a lot of people get a lot of tests and are like, what? But we're looking for so much. The technology's out there. How important, if I see the makings of osteoporosis, that you find it at 30 as opposed to finding someone at 40? Early detection.
So osteoporosis is kind of the syndrome where the bones are very thin, very brittle, high risk for fracture, right? There's a condition called osteopenia, which is a condition where the bones are thin but not brittle, right? So the bones are already starting to show signs.
Is that the first stage? For lack of a better term, you could call it an earlier stage of osteoporosis. So you have kind of normal bone density, osteopenia, and then osteoporosis. So I want to find them when they're osteopenic, right? Right.
So we may not start meds at that time, but that's the point where we check the vitamin D levels, correct the vitamin D levels, maybe check for other causes like hypothyroid. Start that weight-bearing exercise. Get to the gym. Pick up some weights. Throw them around. Load-bearing exercises. Walking. Calcium supplementation.
Are there symptoms, number one? Number two, are the symptoms similar to an arthritic patient coming in saying, gosh, get up in the morning and my bones are creaking?
No. So osteoporosis and osteopenia are typically asymptomatic unless there is a complication associated with them. So if you develop a fracture, if you develop a hunched over posture like we had talked about, those can be symptomatic. But generally speaking, osteopenia and osteoporosis alone are asymptomatic syndromes. So again, early recognition, recognizing the risk factors, smokers, patients who have used prednisone, patients who have had hypothyroid, identify the risk factors, test early and treat early.
Yeah.
So in addition, though, we always talk about our lifestyle choices. What are the things that we can modify on our own? Number one, we've said it, the sedentary lifestyle. Sitting around is not going to make your bones stronger. Use it or lose it.
Great point.
So, heading over to the gym, picking up the weights, throwing the weights around, weight-bearing, load-bearing exercises, not swimming, not water aerobics, but actually load-bearing exercises are going to increase.
So when people think muscle is what they're working, they don't realize also the benefits of bone.
So what's happening is the muscles are being contracted with resistance, and the muscle is putting stress on the bone. In the areas that the muscle is stressing the bone, and that is what's causing the increase in not volume, but increase in density of the bone.
Right.
Okay. So the muscles are causing the stress, and the bone is reacting by strengthening itself. Of course, we can say it. Tobacco use, right? Tobacco just.
Does alcohol have any effect? That usually goes hand in hand.
Yeah, absolutely. Regular alcohol consumption normal alcohol consumption for a male is two drinks a day or less, and for a female is 1 drink a day or less. It's actually pretty liberal for most people. But excessive amount of alcohol increases your risk for osteoporosis without question.
Jumping ahead a little bit, and I hope not too far in front, what are the remedies? I know we've talked about what's caused it. We've talked about lifestyle. We've talked about early detection. And the question now, I've come in and I've either failed, especially at getting to you early enough for early detection. We've talked about prednisone. What other strategies do we have? Is there any better drugs out there other than that?
So there's lots of drugs out there to treat osteoporosis. Again, the first thing that you do is you fix all of the risk factors, right? All the lifestyle modifications, reduce prednisone use if possible, correct vitamin D levels, weight-bearing exercises, stop smoking or reduce the smoking, reduce the alcohol. And then at that point, when someone has either a fracture or has osteoporosis, there are drugs that can be started.
How about surgery? Is that
surgery would be used to correct the effects, or the sequelae associated with osteoporosis. But no, surgery would be surgery would only be used to correct like the fracture. Drugs are the mainstay. The most common drug used is a bisphosphonate. This is a medication that's used to kind of strengthen the bone, decrease destruction of the bone. Everybody knows Fosamax. Fosamax has actually gotten pretty easy to use. You can take 1 tablet once a week, and it will. Studies show that it will modestly increase the strength of the bone. So I can regain my bone. Decrease the risk of fracture.
Not just neutralize the loss.
And again, what we're really looking at is decreasing the risk of fracture. You can take Fosamax, which is a tablet. Some of the problems with Fosamax, it can cause bone pain. A lot of patients don't tolerate it because of their stomach. They take the medication, it causes stomach pain, reflux, heartburn, indigestion. You have to be able to take the medication and sit up in an upright position after you take the medication. So there's some issues with it. Cause sometimes damage to the teeth and the jaw in very rare instances. So there's some concern. Mm-hmm. Hormone-related therapy, estrogen. It used to be easy when all the women had went through menopause, and we just put all the women on hormone replacement therapy, and that was great. It fixed a whole bunch of things, made their symptoms of menopause go away. It strengthened their bones. Great, right? So when I was in residency about 14 years ago, they did a study on hormone replacement therapy, and they had to actually stop the study early because the results were so impressive, right? Hormone replacement therapy increases the risk of many cancers, increases the risk of blood clots, increases the risk of stroke, increases the risk of heart attack. So hormones, just putting women on Premarin or estrogen anymore, is not a knee-jerk reaction. It is something that has to be considered. The patient really needs to understand the tremendous risks.
So it works, but the risk factors.
But the risks are huge. So you take away one problem and then potentially give the patient a bunch of other problems. There's a couple other drugs out, Prolia, Forteo. These are pretty strong drugs. They're reserved for kind of refractory cases or very severe cases, especially cases where patients have had fractures. But again, very easily treated, get tested, modify lifestyle risk factors.
And try to find it soon. He is Dr. Chris Mahr with Colonial Family Practice, coming up on a station break, and we were talking about osteoporosis. And, on a sad note, I did a little research on myself. Still nothing great out there to help with osteoporosis. You've given a lot of examples of how to prevent it on the front end and a lot of examples of things that we can do, but to find a, boom, ironclad solution fix, there is not.
It is not there.
Back with
Gotcha.
more on
We'll be
Medical
right
Forum, presented by At Your Service Home Care.
Reliable Medical Equipment, locally owned and operated since 1999, provides a full range of medical equipment and services. Our accredited facility is fully staffed with the certified personnel for all your diabetic shoe, custom orthotic bracing, and prosthetic needs. Conveniently located at 246 Broad Street, right across from Firestone and just down from Colonial Family Practice. We accept Medicare, Medicaid, TRICARE, and most private insurance. Stop by today or give a call at 934-9212. That's 934-9212 in Sumter or 435-9927. 435-9927 at our Manning location at 37 West Rigby Street. See why Reliable Medical Equipment has been voted best facility for prosthetic and orthotic for 7 years straight. Reliable Medical Equipment.
Looking for your doctor? We're pleased to announce the Toomey Medical Professionals practices became part of the Palmetto Health USC Medical Group. With 500 physicians and providers, we are working together to bring you and your family the broadest range of healthcare services in our practices and across the system, including at Palmetto Health Toomey. Also, you can get the very best care right here. To find your doctor today, visit phuscmg.org. That's phuscmg.org.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care. And now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation. 607-9677.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
We're back. Medical Forum coming to you on 105.9 every Saturday morning. Touching base through Florence, Sumter, Manning area. Dr. Chris Mahr, we were talking about osteoporosis in the first three segments. Chris, well, we got you here for another segment. I want to talk about osteoarthritis real quick.
May is osteoarthritis month.
You got it.
It's every month. May is every month.
Yeah, it's lupus, osteoarthritis. Yeah, that's right. Yeah, Kentucky Derby, if we really want to go back in time a little bit. But always confused and always put in the same.
I heard on Derek's show earlier this week, that is the longest running major sporting event in the United States.
It's 100 years anniversary. Are you talking about the Indy 500 or the Kentucky Derby?
Kentucky Derby.
Yeah.
Longest running major sporting event in the United States.
How about that?
I think it's cool.
Yeah.
I think it's still in the same place, right? It's always been at the Downs.
Louisville, Kentucky.
It's amazing.
Hey, your horses have osteoarthritis, man. They're out there.
They do.
Pounding the ground.
I
right?
imagine.
Anyway.
A little out of my scope, but...
Is that right?
Yeah, a little out of my scope.
I got
imagine
you like smaller patients.
Their bones are probably
with two legs.
Tenuous as ours, if not more.
Well, osteoporosis... great information on osteoporosis, and osteoarthritis sometimes gets thrown in the same realm.
Yeah, and it's completely different.
Okay.
Just
Let's just take one segment
talk about it real quick.
and talk about that. And it probably deserves an entire show because a lot of people have osteoarthritis.
Yeah, and we've talked a lot about osteoarthritis in the past, treatment and things like that because of, we've talked about bracing. So let's just talk about what it is.
Yeah.
I think it's a really good point to make that this is a completely separate entity from osteoporosis, okay? You can have osteoarthritis and osteoporosis, but they're not correlated, right? So osteoarthritis is the most common form of arthritis. This is the wearing out of the joints. This is the bone on bone. This is what everybody talks about. Well, inflammation is the result.
Okay.
But this is the wearing out of the joint space, okay?
All right.
So most common in the United States, okay? It is, again, this is just friction forces damaging the joint, okay? We have protective cartilages in our body, on our knees, that wear out, and then, of course, the bone underneath of it gets exposed. That wears down.
Is osteoarthritis, because I see degenerative arthritis. Synonymous?
Yeah, degeneration is just the wearing out. If we could use the term for our brake pads. Our brake pads wear out, they degenerate.
Gotcha.
It is the same issue.
All right.
So osteoarthritis can affect any joint in the body. We see it very commonly in the hands, knees, hips, spine. And it is about managing symptoms. So we don't have any treatment other than joint replacement that completely changes the disease process itself. So all of the treatments at this point are to manage symptoms.
All right.
And if you manage symptoms, you've got it. Symptoms. What are the symptoms? Now, these are the symptoms that are just also common. Pain in the joint occurs after movement, stiffness in the morning, tenderness when you apply light pressure to the joint, perhaps. So many patients just tell me that they're stiff in the morning and tender in the evening. Loss of flexibility, unable to perhaps move the joint through the complete range of motion that you may have once been able to do. Oftentimes there's a grating sensation, maybe like if you put your hand over your knee and the knee goes through its normal range of motion, you might feel like a Rice Krispie sensation. We call that crepitus, but that's a little kind of a grating sensation over the joint. And then bone spurs. Everybody talks about a bone spur or an osteophyte. Bone spur is the result of the degenerative changes. The bone spur is not the cause. It's the result of the degeneration of the joint.
All right.
So causes, aging, what are the risk factors? Women are more likely to develop osteoarthritis than men. Obesity,
I would
really
think
important.
Workman's comp would be people missing jobs a lot. That this would be a cause that you see. Do you see people coming in saying, I have this now, I can't go to work?
Yeah, absolutely, yeah. I would say that it would be quite a impact on certain patients in performing their jobs. Because of the obesity epidemic and because our weights are increasing significantly, our body mass indexes are increasing, this is likely going to really increase the incidence of osteoarthritis and job loss, work loss, pain, things like that. Obesity is a huge factor in increasing the risk for osteoarthritis. As we age, increase in weight, it puts more pressure on the joints, more stress on the joints, and they're going to degenerate quicker. Certain joint injuries, patients who broke their ankle, for instance, years in the past, that joint has a greater risk for developing osteoarthritis later in life. Genetics
athletes that maybe broke a bone.
Absolutely.
Like Marcus Lattimore had the horrific leg injury. Is this something now? He's probably 26 now. Obviously wasn't able to continue his professional career. When he's 56, is this something that arthritis is definitely going to be?
Probably, yeah. He's probably going to develop osteoarthritis earlier in life. Again, he's going to have degenerative changes. I'm sure there's certain sports that have a higher risk. Female gymnasts tend to really develop because there's a lot of pounding.
It's such a
fly
young
through the air,
too.
pounding of the knees.
Well, they're doing it since they're 6 or 4, and 12, 13 hours a day. I saw where you were talking about that Mary Lou Retton. Most people know, of course, won the gold. Already had 2 hip replacements.
Really? I didn't know that.
36 years old.
Mary Lou Retton is from the same hometown my mother's from, Fairmont, West Virginia. Yep.
Wow.
Yep. Matter of fact,
So your mom's the second most popular person from there.
Second one. Fairmont, West Virginia, Mary Lou Retton. Yeah.
But in your eyes, number one,
gymnast.
Correct? Your mom.
Absolutely.
Yeah. All right, so osteoporosis, osteoarthritis. Let's sum up. We got about 2 minutes left in the segment. I know you got to shoot out of here, and I appreciate you coming in. Osteoporosis, give everyone 30 seconds of a rundown. What is it that we need to know about it, from calcium to early detection to, don't want to steal your thunder on
osteoarthritis.
Osteoporosis.
So osteoporosis,
review a little bit here.
Real quick recap. Get screened, know the risk factors.
Don't smoke.
Important.
There, I got one.
Yeah, there you go. Think of the bone bank. What you take into retirement is what you got. So being active at a young age, an early age, no smoking. Calcium supplementation's kind of up in the air, probably not a bad thing to do. Correct vitamin D levels. Again, risk factors: smokers, patients on chronic prednisone use need to have a bone density.
Not a great cure yet, but in the process. So
yeah,
get early detection,
treat it, but not cure it.
Right, and take care of the things that you can take care of. Osteoarthritis. Last 30 seconds.
Osteoarthritis,
what do we need to
that's
take home?
The typical age-related joint pain, can occur in multiple joints, virtually any joint of the body. AM stiffness, pain after activity. This is a wearing out of the joint. Treat the symptoms, icing, aspirin, comfortable shoes, lots of walking, Tylenol, and if the pain persists, typically it's diagnosed by your family doctor with a X-ray.
Gotcha. He's Dr. Chris Mahr, Colonial Family Practice. When we come back after this brief message, we will have Carolyn Webb coming on from Sumter Active Day, talk about some of the things they've got going out on 401. So we'll be right back.
Great, Jeff. Thanks.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home, and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable medical equipment, locally owned and operated since 1999, provides a full range of medical equipment and services. Our accredited facility is fully staffed with the certified personnel for all your diabetic shoe, custom orthotic bracing, and prosthetic needs. Conveniently located at 246 Broad Street, right across from Firestone and just down from Colonial Family Practice. We accept Medicare, Medicaid, TRICARE, and most private insurance. Stop by today or give a call at 934-9212. That's 934-9212 in Sumter or 435-9927, 435-9927 at our Manning location at 37 West Rigby Street. See why Reliable Medical Equipment has been voted best facility for prosthetic and orthotic for 7 years straight. Reliable Medical Equipment.
Looking for your doctor? We're pleased to announce the Toomey Medical Professionals practices became part of the Palmetto Health USC Medical Group. With 500 physicians and providers, we are working together to bring you and your family the broadest range of healthcare services in our practices and across the system, including at Palmetto Health Toomey. Also, you can get the very best care right here. To find your doctor today, visit phuscmg.org. That's phuscmg.org.
This is Medical Forum, presented by At Your Service Home Care.
We are back. I want to thank Dr. Chris Mahr for coming on and educating us about osteoporosis, osteoarthritis. He's always very informative. And as we went to break, we talked about having Carolyn Webb, Prince, coming on. She is the director, the center director at the Active Day out on 401. Been a pillar of the community for, I don't know how long, 20 years, Carolyn?
Yes.
You got your friend with you, Travis Pruden, who also is the home care director with the Active Care as well. Travis, how are you doing?
I'm doing great. How are you?
Good. Now, we got one segment. We're going to try to speedball through this as quick as we can to give a lot of people information. A lot of people know about your facility and where you're located, but we'll give them that, and then we're going to have you back on for an entire show. So I look forward to that. Carolyn, talk to us about the Active Day. Where are you located? What do we do?
Hi, again, my name is Carolyn Webb Prince, and I am the Center Director for the Active Day Center. We're located at 930 Oswego Highway here in Sumter. It's going north if you...
Not far from here.
Not far from here.
Yeah.
Possibly no more than about a mile and a half from here. And I tell you, we're in a good location. You know, we get a lot of traffic through that area. And so if you...
Basically, 401, when y'all come under the bridge there on 378, don't go too far because it's right there on your left.
You'll miss it if you blink your eye.
You'll miss it. All right, Active Day Center. Talk to us about, everyone wants to know who qualifies. And what we're talking about here, we're talking about an adult daycare where if you have an elder person that needs help and you need help with them, whether you're going to work or you just need a place for them to continue to socialize with people, their peers, their age, that's what you're offering here out at Active Day. Is that correct?
Yes, but well, Jeff, it's not only just for the elderly. You know, we have them there from 18 to 100 plus. We have them there with disabilities, you know, special needs. We have them there for just socialization.
Correct.
But and a lot of times people don't realize it. They think it's just for the client, but it's also for the family members too, who need to get out, who would like to get a job, who would like to just, you know, have a little bit of time to themselves.
Well, what's nice about it, if I understand, this is a resource that is available through community long-term care. There are sources that will help financially pay for this to help them not only in the service when they're there for you, 4 or 5 hours a day they get for the morning?
Yes, it's basically a 5-hour service. But again, like as I was explaining to you earlier, with transportation and all the stuff that goes along with it, it can turn into a 6 or 7 hour day that would give the family some kind of respite.
It's great. And it's a morning?
Yes.
What time does it start?
Because we open from 8 to 4. We open from 8 a.m. in the morning to 4 p.m. in the afternoon. But, you know, we try to get the participants in, you know, as fast as we can. And we're not trying to get them out there. But usually we have them all out around about 3 o'clock.
Gotcha. Now, Travis, you deal with the same people, but they may stay in their home as opposed to taking the Active Day. Is that something that I can kind of bifurcate the two? Meaning, if I qualify, and let's just talk about that. If I qualify, go through the chain of commands, which is a Medicaid-funded funding, which is awesome to allow them to get out and continue to live life, or they can stay in their house. Is that correct? And that's kind of where your function takes over, is that?
That's right. And actually, Carolyn and I do share some participants as well. There are some that we send aides out to in the morning to help get them ready to go to the daycare, and then likewise in the afternoon when they return home from the transportation services from the daycare, we may send an aide out in the afternoon.
Gotcha.
So it can be just home care services they receive from us, or it can be home care in addition to daycare services.
Okay, so you can do both.
Yes.
Very good.
And I want to, you know, we just emphasize Medicaid, but we also have VA. You know, there are other payer sources.
Okay.
There are private pay. There are VA. There are actual grants out there. We call them the Family Caregiver Grant. That's issued through Santee Lynch's Council on Government. So there are many avenues of payment that's
Do you
out
help
there.
them? So if I'm listening out there and I think, boy, this really fits my need. I'm a caregiver and I've lost my identity. I'm at home constantly with my sibling or my parent or my wife and what have you, and didn't even know about you. So now I know, go out 401, Sumter Active Day, I come out there. Is that something that you can help direct me, Carolyn? Maybe I am a veteran. Maybe I do qualify through some disability through the Santee Lynch program. Maybe I qualify through the Medicaid. So there's so many avenues. Is that something that you guys will help vector me through to get me qualified, or at least allow me to know where some of these are out?
Oh, yes. Once we get that call from you or once we get that visit, we practically jump in there and we just kind of like take over.
Right.
Because, again, we know that caregiving can be very stressful. We all love our family members. We don't ever want them to go anywhere, but we know that there are times that we need to alleviate some stress. And so once you give us that call, then that's when I jump in on the rest of the staff members. We will jump in and we will try to make this experience for you as best as we possibly can.
Super. Talk us through, we got about 2.5 minutes left. Talk us through a day I'm at my house and I get picked up by your vans, which I see them across all the time. So it's great. I got transportation. I come in. What do I see? Is there activities that we do? There's there cards? Is there meals? Are there snacks? Do I bring food? What happens on an active day at Active Day?
Well, Travis, his PCAs, like he just say, they go out there to get them ready.
Okay.
So that starts off that Active Day. Once Travis get them ready, Travis's PCAs get them ready, we transport them into the center. Man, it is on then. Because at that moment, we give them their AM snack. We have socialization. We have the hot catered lunch every day. We have devotion. You know, our elderly, they really do love devotions. So we have devotion every day. We have exercises. We do Active Day exercises. If there's anything out there that can keep them active, even word games, puzzles, we go outside. You know, we do hoops. Our basketball goal isn't that big, but we still do hoops. And so they have a really active day at Active Day.
Now, everyone listening out there can tell, if you've never met Carolyn, she is full of energy. She might as well be 25. So I can tell by your voice. Do you get out and practice with them? Are you shooting hoops?
Oh, yes, I do.
Are you good?
They challenge me all the time.
Because now, they can't see through the radio. You're not the tallest chick in the room. Now, so you better be a good shooter.
Hey,
is this Seth Curry like?
Absolutely. Hey, you know what? I can slam dunk.
Now, Travis, on the other hand, got the height. And Travis is so I think this, and we're not making light at all, because I believe, I see that energy. You get them in, and life starts there. It's not a sit over in a corner, and I think that's one of the wonderful things that you bring, and you've done it for...
I've done it. I've been there. Well, I was there before. I left, came back. Yeah. So on this tenure, I've been doing that almost 18 years.
We started together.
Yes.
We did. We started together. Travis, I've known Travis in the community forever as well, too. Guys, we've got about 35, 45 seconds. Travis, give us contact information for you. How can I get a hold of you? If it's something that I think I need to home care, or as you said, you work with Carolyn as well, give us a couple contact numbers of how to get with you.
The easiest way to reach us is at the Sumter office phone number, which is 803-436-7420. And that phone line is actually available 24/7, so you can reach us anytime for questions or information.
Physical address, Carolyn?
Physical address, 930 Oswego Highway.
And very easy, as we said, just if you're coming out from Toomey Hospital or you're coming that direction, go by Burger King, go under the bridge, go left, and don't go too far because it's right there. I want to thank you guys for coming in. We're going to get you on for an entire show. I know all the things that you offer. You had to be brief today. I appreciate the overview, and we will bring in all the things that you guys do, and you do a great job out there. Thank you so much.
Thank you.
Everybody, have a great weekend.